Orlistat embodied the dream of all fat people. You can eat anything and do not get better, because when you take a capsule, calories from fat simply do not get it. From the side, this action of the drug seems to be real magic. In fact, everything is not so simple. Orlistat, there are many side effects and there are all kinds of things that will not work even if you take it in. Although at first the extra pounds will really start to leave their owner, tens of thousands of women and men have already experienced the action of fat blockers. A lot of side effects. The drug is in great demand. Reviews of Orlistat women weighing more than 100 kilograms indicate the possibility of losing weight a week for 5 to 6 kilograms, subject to taking 300 to 400 milligrams daily of the active ingredient, equivalent to 3-4 capsules of the drug. The first week of admission is getting used to the dosage and possible ailments, diarrhea, dizziness, digestive disorders, bitter taste in the mouth. If you endure these unpleasant symptoms, then after a while the figure on the scales will begin to inexorably decrease. Instruction and feedback about Orlistat indicate a lack of correlation between the amount of weight loss and the increase in dosage. There is no need to take more pills, it will not affect the rate of weight loss. Doctors refer to such radical methods of losing weight worry. Too many side effects and contraindications make it unacceptable to take Orlistat for people with chronic diseases of the liver and gastrointestinal tract. With the unauthorized reception of Orlistat, many of the slimming people were in hospital because of the internal bleeding or intestinal obstruction, triggered by the ingestion of capsules. Patients who still decided to take medicine, doctors recommend not to pin all hopes on the action of Orlistat, but to exercise more often physical activity and monitor their nutrition. The drug for weight loss Orlistat does not lead to tangible side effects, while observing the recommended dosage. With increasing doses, the following problems may occur: spontaneous discharge of undigested fats from the anus. Violation of intestinal peristalsis. The rectum often loses its elasticity due to neglect of the recommendations for taking the medication. Flatulence as a consequence of the fat metabolism that is not balanced by the drug and the deficiency of fat-soluble vitamins. Absolute contraindication is the presence of neoplasms in the esophagus, stomach, intestines. Indirect contraindications: chronic pancreatitis, cholecystitis, diseases of the liver and gastrointestinal tract. Before the reception of Orlistat and its analogues, it is necessary to consult an experienced gastroenterologist. Do not conceal that you are going to begin taking a drug blocker of fats. In rare cases, it is possible to develop internal bleeding. In order to avoid this, it is necessary to be sure that there are no contraindications. The drug is also strictly contraindicated in pregnant and lactating women, children under 16. If you are taking a medicine for the first time, start with small doses. At breakfast, take 1 capsule, listen to the sensations of your body. If there are no side effects, it makes sense to raise the dosage to 2 capsules per day. Exceed the dosage of 3 capsules per day is not even for people with a 3rd degree of obesity. Let it not bother you its price. Reviews of those who lose weight about Orlistat testify to the lack of correlation between the number of dropped kilos and the increase in dosage. There is no need to take more pills, it will not affect the rate of weight loss. In parallel with the reception of Orlistat, doctors recommend to drink a quality vitamin-mineral complex, because in connection with low absorption of fats the body loses a significant proportion of fat-soluble vitamins. Therefore, it is important to establish their receipt from outside.